It is 6:07 right now. There's a recent CDC report ranking Maryland as one of the top states for completing both doses of the two-dose COVID vaccines. WMAR 2 News' Mark Roper is outside M&T Bank Stadium, which is also a mass vaccination site. So, Mark, what are health officials saying about this new survey?
Yeah, good morning, Christian. The CDC found that more than 90% of the people in our state who get their first dose of either the Pfizer or Moderna vaccine get their second dose within the proper time frame. Many health officials see this as one of the bright spots in the effort to vaccinate Maryland.
According to the CDC, Maryland ranks 15th in the nation for people getting both shots of the two-dose vaccines. So who does Maryland Department of Health Assistant Secretary Brian Moroz think is responsible for these numbers?
I always want to thank the Marylanders because they're the ones who ultimately are responsible for getting their second doses. So it really is a credit to all the Marylanders who are out there.
Moroz also points to a series of reminders which begin the moment people show up for their first shot.
You go to our mass vac sites, we're setting up appointments immediately when they get their first appointment. We do utilize the full spectrum of contacts. So when they leave the site, they get a piece of paper that they can hold in hand. We get an email, we get a phone number, we call, we send a reminder, we check in. So we're trying to hit it from all different directions.
So now we have an approach that says we're going to approach you to ensure that you have a comprehensive scheduling approach. Second, we have a multidisciplinary administrative approach. And that's why I think you're seeing some good data come out of the CDC.
Dr. David Marcosi is the COVID-19 incident commander for the University of Maryland Medical System and a senior medical advisor to Governor Hogan on COVID-19. UMMS manages the M&T Bank Stadium mass vaccination site in a joint partnership with the state. The Maryland Health Department has set a goal of getting 100,000 shots into arms per day as the total number of doses given continues to add up.
You're seeing a substantial growth in a short period of time from 0 to 1 million and then 1 million, to 2. So we're seeing a significant impact of the amount and exponential growth of the vaccine capacity in our state to put shots in arms.
Captain Robin Toblin is the epidemiology team lead for the CDC COVID-19 Vaccine Task Force. She's also one of the authors of a CDC report, which takes a look at how many people are going ahead with their second dose and how much time has passed between vaccinations.
And we were really excited to see that, that 96% of people who got the second dose got it in that recommended time frame. That's a really high number to see. So we were excited about that. And the fact that 88% of people had completed their second dose in that allowable time frame, or the recommended time frame, that was great news too.
So why would some people skip getting their second dose when many waited so long to get their first?
I would imagine it happens for every reason that we could imagine, that we all miss every appointment. I couldn't make the schedule. I forgot. I tried. I know you sent me reminders.
Now, Dr. Marcosi, the UMMS COVID-19 incident commander that you heard from, he does expect the overall number of doses to continue to increase, especially with those 2 new mass vaccination sites, as well as when more options to get the vaccine become available, such as doctors' offices. Reporting live in downtown Baltimore, outside M&T Bank Stadium, Mark Roper, WMAR 2 News.